Hello, my name is Angela Pineda. Honestly, that's a really fair question to ask. What the heck is medical humanities and how does it prepare someone for healthcare? You know, what is it really? So, especially for a role like ultrasound, that's what the role I want to go into, where people usually think it's all about like a technical skill. I'm a medical humanities major with a minor in biology at Montclair State University, and I'm pursuing a career as an ultrasound technician. For me, medical humanities makes sense because ultrasound is one of the most patient-centered roles in healthcare. You're not just working with machines, you're working directly with people, often in vulnerable and stressful moments. Um, Medical humanities focus on the human side of healthcare. It looks at how patients experiences illness, uncertainty, and medical environments and how communication, empathy, and ethics affect care. In ultrasound, patients often are anxious and in pain or are afraid of what the the scan might reveal. Medical humanities trains me to recognize that these emotions and responses are in a way that may help patients feel safer, respected, and heard. If whatever they need, I will take care of. Um, my biology minor gives me the scientific foundation I need, understanding anatomy and physiology and how imaging connects to their diagnosis. Um, But medical humanities is what really helps me apply the knowledge that in a real clinical setting like a hospital. So it teaches me how to explain procedures clearly, read nonverbal cues, and adjust how I interact with patients based on their comfort level and emotional state at the time. Ultrasound technicians are often with patients during moments of uncertainty. Sometimes patients want reassurance, sometimes they're quiet, they're scared, they're overwhelmed, they sometimes they speak different languages, they don't really understand what you're saying. So it's definitely medical humanities where it's come to play because it shows you how, to interact. So with the human side of things, not the biology side, the human side. So the empathetical, the compassion, the patience, you know, with it also comes to play. So medical humanities prepares me to handle those moments professionally and compassionately without overstepping any boundaries. It teaches me the importance of presence, knowing when to speak, when to listen, how to maintain patient dignity and especially patient information, especially with HIPAA laws, you know, at all times. Um, an important part of medical humanities is ethics. So in ultrasound, there are usually situations where you see something concerning, but you can't really share those information or the results directly with the patient because of HIPAA laws and everything like that, especially with other laws. Um, Medical humanities really helps me understand how to navigate those moments really like ethically and professionally. So staying within professional roles between that time of doing their scan and, you know, noticing their diagnosis but not really telling them at the same time is really where, you know, patient confidentiality comes into play. And so, you know, you would say something like, you know, I can't really share your results right now, but the doctor will see your results in 1 to 2 days. So if you can wait for the doctor, that would be great. Thank you. And so that's something that I would say to the patient. Um, Medical humanities also emphasizes cultural awareness and communication across and many differences of many different cultures and many different languages. So many patients come from multiple backgrounds, multiple languages. Some even speak three, some even speak two, some people will speak one. It could be either like English, it could be Spanish, it could be French, it could be Arabic, whatever it may be. You want your patient to come in to feel as comfortable as possible, especially if they had a negative experience at another hospital or something like that. It's something you would take in consideration of. Um, Being trained to recognize those factors helps me create more comfortable and respectful environments during imaging procedures. Um, what medical humanities really adds up to my training is the ability to connect technical skills with human care. Anyone can learn how to operate an ultrasound machine, but it's more of the connection with the person and the feeling that you have. So you have to feel calm and collected and doing your job, but at the same time, you have to know what to do and act in these situations. Certain situations, it could be an emergency or it could be like something very minimal. So, um, when I think about what medical humanities really prepares me for, is that as an ultrasound technician, I see it as training for moments that matters the most. The patient interaction, the ethical decisions I make, the trust that patients have in me during their procedures and their vulnerable moments, combined with my biology background, it allows me to approach ultrasound not just as a technical skill, like I said, but as a form of patient-centered care. That's what I really stand for. Um, Medical humanity has taught me that good healthcare is not only about accuracy and efficiency, but is also about, like I said, empathy and communication and professionalism. Those are very, very defined qualities where direct impact between the patient's experience, and they're especially important in a role like ultrasound where patients' comfort and trust are really, really essential. So when someone asks me what medical humanity really is, I explain to them that it prepares healthcare professionals to care for patients as a whole, not just as some person, but family almost. So that's exactly the kind of ultrasound technician I want to be in the future. So hopefully everything will work out great. But thank you, and I really appreciate for you taking your time for this interview. Thank you.